Hi, I'm Karunya Morgan. I'm the program director here at the Puerta Del Sol location. This is in San Clemente, California, and this is our headquarters. We are starting here in our lobby, and I'm going to show you where all the clinicians sit. Come this way. This is where all our clinicians, our drug and alcohol counselors, some of our clinical supervisors, a lot of our corporate staff are sitting. We like this community because we can all work together, we can bounce ideas off of each other. If someone has something due and they're unable to do a group, then they can just turn to their fellow colleague and say, hey, can you go run that group for me? And they're really a strong team. They're always helping each other out. So here is where we have our multidisciplinary treatment team meetings. We come together each week to discuss every patient that we have. It's a really nice community. Let's go this way. This is where the process begins. When the patient first arrives, either by themselves or with their family, they come to this office. We always provide them snacks and water when they come. There's plenty of seating in case they come with their family. Their first stop would be in the intake department, and that's where they're going to sign all of their intake forms. And then they're going to do an assessment. Come this way. We have individualized session rooms where the assessments happen. We've offered each patient a comfortable reclining chair because the intake process can sometimes be uncomfortable. We have snacks in every office, and we also have food. Some of our patients come a long way and haven't eaten properly on the plane, and so we always have food available to them. Our intake nurse does nursing assessments here. She'll weigh the patient, she'll take their temperature, she'll take their initial blood pressure, and like I said, do her own assessment. Okay, let me show you where they actually program here. On average, we have about 60 patients per day that attend groups here. They're from the PHP level of care, partial hospitalization level of care, to the intensive outpatient level of care, as well as the outpatient level of care. Come this way. This is one of our individualized session rooms. This particular room is set up for a family. As you can see, we have more chairs here. We always have a computer available in case they need to look up references for the patient. And then here we have one of our group rooms upstairs. This particular group room will hold 15 of our patients. We'll have usually 1 to 2 facilitators per group. We offer relapse prevention, assertiveness training, life skills training, identifying triggers, anything that would help in the recovery from substance abuse. Here in San Clemente, we have over 20 homes. Our patients are usually going to stay in the home for 2 or 3 weeks at a time. We have detox homes, we have regular residential homes, and we also have specialty programs like our executive house for a natural assisted detox. Typically, they're going to program at the center for 6 hours and then come back to the home. When they come back to the home, they're going to have a nice meal cooked for them, or they may assist in cooking the meals. I hope you're enjoying the tour. I'm going to show you our downstairs suites now. Like I said, we average about 70 patients a day, so we need large space for them. When they get to the center, they'll come here and they'll sign in. Our lovely receptionist will greet them. They can have a seat, and they can wait here until their group begins. We also have our urine analysis department here. Let me show you some of the group rooms that we have available here too. Come this way. This is our art room. Of course, every patient loves the art room. Every project that they work on has to do with their psychological well-being. It's really a nice emotional release for most of them. Even if they can't do art, they find that the expression has really helped reduce anxiety and depression. This is our medical department. As you can see, we have a nice, welcoming reception area. In this office, we have the doctors, the psychiatrists, and the nurses to assist in the medical care of our patients. Typically, a patient's going to see the doctor every 2 weeks. This is our cognition lab. This is where we do normal cognition programming. Patients have this group 2 times a week. And for them, it feels like they're just playing video games, but for their brain, it feels like it's healing. What we also use this particular room for is our Next Step program. We help them build resumes, we help them with interview skills, we help them fill out applications. They can use all of these computers to search for jobs. We also help our outpatient programs who have gone on to the next level. They can always come back at any time and we can help continue build their work skills. Next, I'm going to show you where we do yoga. Here at Sovereign, we take the holistic approach to healing our patients. And one of the ways we do that is offering yoga classes. We have found that yoga really helps quiet their mind, helps them learn how to breathe, and might even give them a spiritual connection. So you see this room is large enough for them all to have plenty of room, and they really enjoy their yoga. But this room is also used as a training facility. We offer trainings for our clinicians weekly in a group setting with different professionals from the area. Another thing that we do in this room is we come together as a community and we celebrate milestones. Either they're completing the program and going on, or they're phasing up to the next phase in our program. We serve so many patients every day, we really want to give them an opportunity to have smaller group sizes. So this is yet another one of our group rooms. We have gender-specific groups, male and female. We offer process groups. We offer addiction recovery groups. We offer grief and loss. We offer seeking safety, which is a trauma-based therapy. We offer the art therapy. We offer the cognition lab, and the list goes on. Everything that we can do to help the patients. Thank you for joining us on this virtual tour of the Puerta del Sol Sovereign Health Group facility. This is our corporate headquarters. Once again, my name is Karunya Morgan, and I am the program director. It was my honor to show you our great facility. If you or a loved one is in need of help, please reach out to us. Thank you.